Hello everyone. So welcome to my YouTube channel Anatomy with Wajahat. So the first topic that we are going to study now is scapula. The scapula is also known as the shoulder blade or shoulder bone. It is a large triangular flat bone which lies between the second and seventh ribs. So this is your scapula, and if you isolate this is your scapula. This is the medial side while this is the lateral side of the scapula. The scapula articulates with two other bones. One is the acromial extremity of the clavicle. So here it is articulating with the acromial extremity of the clavicle if we see it from the superior end. So this is your clavicle and this is its acromial uh, end, while this is the acromion of the scapula and it is articulating with the clavicle. And the second that it articulates with is the head of the humerus. So this is your humerus. Now the major defining features of the scapula are its three borders, that is the superior, medial, lateral, three angles, superior, inferior and lateral, two surfaces. It has two surfaces, one is the dorsal and costal, and three large bony processes, spine of the scapula, acromion and coracoid process. So we'll study these one by one. First we'll come towards the borders, the superior border. So if you see the superior border, this is your superior border. This is your superior border. This whole is your superior border. Okay. The superior border is a short, thin superior edge of the scapula. This is your superior border. Now there is a scapular notch which is located on the lateral aspect of the superior border. On the lateral aspect of the superior border, just near to the base of the coracoid process. This is your coracoid process and it's located near its base. Now what is the importance of this scapular notch or suprascapular notch? That a superior transverse scapular ligament bridges this notch. So if we see that a superior transverse scapular ligament bridges this notch. So you see this is your superior transverse scapular ligament, this bridges your notch. The importance of this suprascapular notch is that the suprascapular artery passes superior to this ligament while the suprascapular nerve passes inferior to this. Now remember there is a easy mnemonic for it, that usually the army goes over the bridge while the navy goes under the bridge. So the army or artery goes over this bridge while the nerve will pass under it and the navy goes under the bridge. Let's move on. So the medial border, if the medial border, this is your medial border. The medial border is a long medial edge of the scapula and it lies closest to the vertebral column. The lateral border, this hole is your lateral border. The lateral border is a thickened lateral edge of the scapula and it lies closest to the axilla. This is your axillary region. So it lies closest to this. Now let's study the angles. The superior angle, as we already know that the angles are formed by two borders. So your superior angle, this is your superior angle, this is your superior angle, and the superior angle is made by the junction of the superior border and medial border. The inferior angle, this is your inferior angle. The inferior angle is made by the junction of the medial and lateral borders. Okay. Now the inferior angle of the scapula can be easily palpated in a living subject and marks the level of the seventh rib and spine of the seventh thoracic vertebra. So if in this diagram you can see that the examiner is examining or palpating the inferior angle and it is present at the level of seventh rib or spine of the seventh thoracic vertebra. Lateral angle, this is your lateral angle which contains the glenoid cavity, head and neck of the humerus. So the lateral angle is formed by the superior border and lateral border, the junction of the superior and lateral borders. It is the thickest and most complex part of the scapula. It is the most complex part of the scapula, mainly composed of a broadened process which is known as head of the scapula. So this outer hair is your head of the scapula, and this head of the scapula is connected to the rest of the scapula by a constricted area, to the rest of the by a constricted area which is known as neck of the scapula. So this here is your head of the scapula. This constricted part is your neck of the scapula. This strip is neck of the scapula, while this is your head of the scapula. Now, on the head of the scapula, its lateral surface, there is a cavity. Lateral surface of the head forms a shallow articular surface for the head of the humerus. So this is your glenoid cavity, which is the articular surface for the head of the humerus. Glenoid labrum. So what is glenoid labrum? If we hide these structures, so you can see that this is your glenoid labrum. This is your glenoid labrum, and what is it doing is that the glenoid labrum is a fibrocartilage ring that rims the margin of the glenoid cavity and serves to broaden and deepen the joint cavity, so it stabilizes your glenohumeral joint. So if we see that if this glenoid labrum is not present, so the cavity is not as deep as it is with the presence of this glenoid labrum. What is supraglenoid tubercle? Supraglenoid tubercle is a small elevation. Supraglenoid tubercle is a small elevation on the superior end of the glenoid cavity, a small elevation that is located at the apex of the glenoid cavity near the base of the coracoid process. So this is your supraglenoid tubercle. And similarly, below there is your infraglenoid tubercle, which is located inferior to the glenoid cavity. It is a small roughened area which is present below the glenoid cavity. Now there are two surfaces that we already discussed. This is your dorsal surface and this is your costal surface. This is present at the back, while this is present this is facing your posterior chest wall. So if we can see in another diagram, in a trunk diagram, that this surface, this is the dorsal surface, while this surface, which is the costal surface or anterior surface, is facing the posterior chest wall. Okay. Now let's come toward the dorsal surface. The dorsal surface has a major bony process which is known as spine of the scapula. So this structure over here is your spine of the scapula till here. This hole is your spine of the scapula. And what it's doing is that it is dividing your dorsal surface into two fossas. The superior smaller one is known as supraspinous fossa. It is smaller trough-like area superior to the spine, while a much larger area is known as infraspinous fossa. And the spine runs from the medial to the lateral side. Okay. Now what happens is that the lateral border of the spine blends in the neck of the scapula. So this is the lateral border of the scapula, and it is blending in the neck of the scapula and making a passageway for the supraspinous fossa and infraspinous fossa. So it's making a passage between these two fossas, and this notch-like passageway is known as spinoglenoid or greater scapular notch, and it's connecting your two fossas. So the clinical importance is that when the suprascapular nerve and suprascapular vessels pass through this scapular or suprascapular notch, and then they pass from here, and then they pass from here, and then these nerves supply their muscles. Okay. So the acromion, what is acromion? Acromion is the broad flattened end which is the lateral extension of the spine of the scapula. This forms the easily palpable tip of the shoulder. So this spine of the scapula continues and forms your acromion. So this is your acromion. This part is your acromion. Okay, and then it articulates with the scapula. Now the costal surface, if we come towards the costal surface, which is facing the posterior chest wall, lies against the posterior aspect of the rib cage. It has a large part of this aspect surface forms the shallow concavity which is known as subscapular fossa. So this is your subscapular fossa. Okay. What is coracoid process? A beak-like or crow's beak. It looks like a crow's beak. This is your coracoid process. That it is a structure that projects anterolaterally from the junction of the neck and lateral end of the superior border. So this is your superior border, and from its lateral aspect, just below, just from the base of the neck, the coracoid process arises, and it can also be palpated just below the lateral end of the clavicle. Inferior to the lateral end of the clavicle, this coracoid process can be palpated. Now, clinical notes: fractures of the scapula can occur in accidents or in automobile accidents or in crashes. And what happens is that this scapular fractures are usually accompanied by fractures of the ribs. Most fractures of the scapula require little direct treatment because the muscles of the anterior and posterior surfaces adequately splint these fragments. So if a scapular fracture happens, the muscles hold these fragments in place, so usually they require little direct treatment. Now, what is dropped shoulder? If you see in this diagram that the patient has a drooping or drop of the shoulder on one side while this side of the shoulder is above, and you can also see the differences in their inferior angle. So the position of the scapula on the posterior wall of the thorax is maintained by tone and balance of the muscles attached to it. If one of these muscles is paralyzed, the balance is upset. So in drop shoulder, what happens is that paralysis or weakness of the trapezius muscle occurs. So this is your trapezius muscle, which is this is your trapezius muscle, and what it's doing is that it's holding your scapula in place with other muscles. So when there is a paralysis or weakness of this muscle, so your shoulder will be dropping. Okay, so this is dropped shoulder or dropping of the shoulder. In winging of the scapula, what happens is that there are three different muscles involved. If this is how the winging of the scapula looks like, and this may or may not be accompanied with dropped shoulder. What happens is that if there is an injury or weakness, if there is an injury to the long thoracic nerve, so it will damage the serratus anterior muscle. If this is the most commonest type of the winged scapula. If there is an injury to the spinal accessory nerve, so it will be damaging the trapezius muscle. This is the second most commonest, and the least commonest is the damage to the dorsal scapular nerve, which will be innervating your rhomboids. Okay, so this was all about scapula. So if you did like my video, please subscribe and like. Thank you.